welcome to another episode of the DeFaba podcast with me, your host, Dr. Lilian Kerubo, a pediatrician and behavior enthusiast. In DeFaba podcast, we talk about behavior and development of children and how to best support them so that they can have the best experience out of life. And this season, we have been talking about disabilities and how they affect children and how we can best support them even as they go through journey with their disability. And today we are going to talk about joint deformities because joint deformities are a common cause of disabilities in children. Joint deformities refer to differences in the structure and function of a joint, and it can be caused by either diseases or injuries. So we all have many joints. Not sure how many we have, but we have a lot of joints in our bodies, and basically a joint is where two or more bones meet, and it's usually a point of extreme mobility because it's at that point where the bones change position and rotate. So it's a point that is exposed to a lot of friction, a lot of tension, a lot of hyperactivity, and so this makes it a sensitive area of our bodies that can easily get damaged or injured or affected. What are some of the causes of joint deformities in children? Most of them are diseases such as rheumatoid arthritis, and this is inflammation of the joint, which if not treated can lead to joint destruction and ultimately joint deformities. We also have other diseases such as hemophilia, and hemophilia is a bleeding disorder where people who have this disease pour blood inside their joints. You also can have diseases such as polio. Polio affects the nerves of a muscle, and once the nerve of the muscle has been affected, the muscle becomes useless. It's not able to contract and relax as it should, and that means the joint positioning is affected because joints are moved by muscles. Burns, if you get a serious burn around a joint area, it can lead to joint deformities because of the formation of contractures, which means that the joints are stiff in a particular position because the muscles around the joints have been burnt and destroyed by the fire, and so this person is not able to move the joint as they would prior to the fire. If you have injuries in the joint, maybe you have fractures of the joint or you have dislocations of the joint, this can affect how the joint functions and how the joint appears. So what are some of the difficulties or the challenges that are experienced by children who have joint deformities? The commonest challenge they have is pain. If a joint is not functioning the way it should, if it's not in the position that it is anatomically designed to be in, more often than not, the person or the child will feel pain. This is because joints have been designed to operate in a certain position and to work in certain angles and through certain rotations. And when those are not being observed, or when the joint is forced to maintain a certain fixed position, or if the joint is forced to rotate at certain angles where it is not designed to, often the child will experience pain. If the joint is being held in an unnatural position, or it's being used in unnaturally in unnatural angles and in unnatural frequencies, the joint becomes it becomes destroyed over time. It starts to go through wear and tear, and so the joint becomes thin, the bones become small, and the joint eventually becomes destroyed. If the joint is not being used as it should, maybe because of paralysis or because of pain, then the muscles surrounding the joint undergo what we call as atrophy, because those muscles lose power and lose energy, and so the muscles become wasted, and eventually the person may lose the ability to move that joint completely. Children with joint deformities also go through self-esteem challenges. This is because they get a lot of stigma, they get a lot of discrimination because of how their joints look and because of how their body is positioned. So they end up having a lot of esteem challenges. They may end up having depression and very feelings of extreme isolation. Eventually, if the joint deformity is not corrected, then these children may get a permanent disability, especially if this is an important joint when it comes to mobility or manual functioning. So for example, if it's the knee joint or the hip joint, which are joints that are very necessary for us to walk or run, if these joint deformities are not corrected, it is very possible that the child might lose the ability to walk, or if they walk, they may walk with a limp. So it's important that joint deformities are attended to promptly and correctly. So how do we support children who may have joint deformities? The first thing we should do as parents and guardians is to visit our healthcare provider, our primary healthcare provider, wherever that may be, so that we can get a proper diagnosis, because some of the joint deformities might be reversible. For example, if it's hemophilia, there are treatments available for hemophiliacs so that they don't destroy their joints. If it's rheumatoid arthritis, we do have treatments that prevent joint deformities in rheumatoid arthritis. If it's a burn, the burn needs to be attended to promptly and correctly to avoid contractures, which may eventually lead to joint deformities. So the first step is to always visit your healthcare provider so that a proper diagnosis may be made and appropriate therapies may be instituted. Once the deformity has been assessed and a diagnosis has been given, more often than not, the child may require strength training and physiotherapy to gently try and correct the joint deformity, or even if not correct it, to make sure that the muscles around the joint do not become wasted or become atrophied. So it's important that this child gets support in the form of a physiotherapist or a specialist who is trained to maintain the strength of the muscles surrounding the joint and to try and recover the functioning that may have been lost by the deformity of the joint. As parents and guardians, it's also important that we make sure our children do not encounter further injuries which may affect the functioning, which may worsen the functioning of the joint. Because of the unnatural positioning and unnatural angulation of a joint that has been deformed, these children are subject or are at an increased risk of getting further injuries. So as parents, we should make sure that this does not happen by making sure they are playing in a safe area and that they have the appropriate protective devices. As parents and guardians, we should also counsel and encourage our children when they have joint deformities, because sometimes the joint deformities are irreversible, and so they may end up facing a lot of stigma and bullying, and people may stare at them. So as parents, we need to build up our children for them to have confidence, for them to know when to report a bully or a person who is basically harassing them based on their physical appearance. We should also be doing regular check-ins with them to assess their mental well-being and know when it's time to intervene by taking them for counseling or for a psychologist opinion to see whether their physical disability may be impacting their mental well-being. As parents and caregivers and even healthcare workers, it's important to advocate and get accommodations for children who may have joint deformities. Most of these children may require accommodations in the classroom. Maybe they may require a special chair. They may require that the classroom entrance is fitted with a ramp. They may require orthotics, surgeries, or prosthesis just to help with their joint deformities. So it's important as parents that we know this and we support these ventures. They may be financially draining, so it's good to know where to get help. It may be in the form of support groups or organizations that support children who may have joint deformities. So these are some of the few ways that we can support the children in our community who may have a joint deformity. Remember to like this episode, to share it with somebody who you think may benefit from it, and to comment wherever it is that you're listening to us from. Till next time, have a good one. Bye-bye.